As of today, this is the listing for PIMS, which is a potentially associated COVID-19 post-infection syndrome, not a disease in and of itself. Pediatric inflammatory multi-system syndrome. Provisional name for it. Half tested positive for exposure to SARS-CoV-19. Most had negative tests for the virus in their system, therefore they are past the infection stage where they can't really pass it on. Maybe a severe pediatric COVID-19 post-infection hyperinflammatory shock and abnormal immune response that happens after a viral infection ends. It's past the contagious stage for COVID-19 in each case so far. Fewer than half had any respiratory symptoms, and many said that there weren't any before. More than half reported a rash, abdominal pain, vomiting, diarrhea. Many came in with conjunctivitis, redness of the eyes, peripheral edema, swelling outside of the body, on the limbs, extremity pain in those same limbs. Some came in with myocarditis, a cardiac inflammation. Tests in the blood, which I can't pronounce, but I'm going to attempt to. High levels of erythrocyte sedimentation rate. I ruined it, sorry. Elevated concentrations of troponin, prohormone brain natriuretic peptide. It's going to have an initialism. High levels of CRP, that's C-reactive protein, I can pronounce that. Procalcitonin, ferritin, triglycerides, and or D-dimers. These were blood tests that confirmed something's wrong, when they said they're doing blood gases or blood work. So far, no causality established between the virus and the disease, this syndrome, not a disease, because it can happen without any signs of the virus ever coming near them or any report of the behavior. Acts like Kawasaki disease or toxic shock syndrome. I'm familiar with the last one. So here are the things you have to see happening, and there is variable reporting on whether or not 1, 2, or 3 of these is required for you to think maybe your kid may be in deep trouble. Abdominal pain without another explanation. Both eyes appearing pink or red, so it has to be both eyes. It has to have gotten into their system. It has to be systemic. That's one of the signs it's in both eyes. Enlarged lymph nodes or lymph glands on the side of the neck, specifically upper respiratory symptoms that, if you're not aware of it, when you have a virus, sometimes you get lymph node inflammation, but usually with bacterial infections, you'll definitely get it, like a jaw infection or an eye socket infection. Well, not definitely. Some people don't have that either. Fever for 7 or more days in an infant for which there's no explanation identified. Red cracked lips or red tongue that looks like a strawberry, which is an indicator of Kawasaki disease. Rash, generally. Swollen hands and feet, which might also be red. Now I'm going to read the symptoms for Kawasaki disease. The name of it is mucocutaneous lymph node syndrome. It's very rare, fewer than 20,000 cases per year in the United States, and most of them resolve okay. But it looks like this. A atypical version of it has all of those features. That's why it confused people. Except for the blood work showing some sort of extra characteristic, and in many cases being associated with COVID-19. If it walks and quacks like a duck, it's Kawasaki disease. If it only seems to happen in a large number, it isn't a large number yet. There's only 100 cases so far total. May not be associated. What about toxic shock syndrome? Now, this is normally something that responds to a bacterial infection that is doing something to you to deliberately antagonize your system, or seems to be, and causes you to have an inflammatory response that's way out of range of what would be needed to take care of a bacterial infection. Toxic shock syndrome shows up 1 to 2 weeks after the onset, and sometimes during, an acute streptococcal or staph infection, strep or staph infection. You have a high fever, hypotension, not hypertension, low blood pressure, a rash with the palms and soles of the feet having skin peeling or desquama, I can't pronounce it, just skin peeling. You get a rash where your skin peels. sometimes in 100% of your body, usually around the site of an infection if it's a surface infection. Severe muscle pain, aches, vomiting, diarrhea, headache, non-focal neurological abnormalities, sometimes deadly multi-organ failure of 3 or more organ systems. What happens in that case, and I'm going to speak specifically of staph, it produces something called staph scald, if it's a minor case of this. What that means is the staph infection produces a waste material that has the effect of digesting the tissue. I'm very, very much aware of this. And the thing is, if it gets into your bloodstream because it breaks a blood vessel and the blood vessel starts pulling in the toxic waste material, it gets into your system and a little bit of it will hurt you a lot. Similar thing can happen with, of course, streptococcal pyogenes, strep infection. And it can also happen from strep throat. Usually it's a skin infection that's strep. And the staph, it's Staphylococcus aureus. Usually it just means skin infection from a hair follicle, but it can be anything. That's why you always clean the infection up. And if you're like me and have an immune system that's stupid about one specific thing, staph, it can be deadly until your immune system eventually learns how to deal with it. Kawasaki disease I've heard of, but I've never actually looked it up. But it has basically all the same freaking problems with it. That's why it's so confusing. So they check, did they look for scratches, wounds? They look for bunched up material underneath the skin. That's a sign of a healing wound under the skin. An infection that gets under your skin can infect a large area, be very hard to detect, and then put off this compound or chemical cocktail of bacteria generates. And it has the effect of digesting you so the bacteria can go through pathways, tunneling. Now, off on that tangent, well, I'm not on it anymore. Let's go off on something else. It is coincidental, what we're talking about, PIMS, a pediatric inflammatory multisystem syndrome, is coincidental with the end of having COVID-19. And the timing isn't known yet. Not enough cases have come in to find out if it's consistently 1 or 2 weeks afterwards or just a few days. Also, again, people can be asymptomatic, not show any signs of any infection. And kids could have a reaction, very bad reaction to it, of having COVID-19 go into their system, attack them, and then their immune system does some sort of strange thing. Maybe it's the immune system doing it. The treatment so far is just giving someone a lot of treatment for for treatment for the inflammatory reaction to get their immune system to stop attacking itself or stop responding violently to whatever it is that was left behind. It does not appear to be a separate virus or disease associated, and they're testing the heck out of that. But we've lost some kids to this. We don't know exactly what it is. It may have absolutely nothing to do with COVID-19. Anyway, the symptoms that you watch out for in the group of them, and again, this is going to change. We're no more than 2 weeks into this, of people actually collecting this information. Stomach pain with no other explanation being obvious. Eyes appearing pink or red. Enlarged lymph nodes on the side of the neck. It would probably be symmetrical, but doesn't have to be. But the eyes would probably have to be. Severe fever for more than a few days. No other explanation available. Red or cracked lips or a tongue that looks like a strawberry. Because in the mouth, in the mucous membranes in the mouth and sinuses in the eyes, it's reacting violently. A rash, swollen hands and feet, which might also be red. And yes, skin peeling, but that's not the most typical response. So just swelling. Has to do with how your body shunts things to the skin and the peripheral body. This appears to be a hyperreaction or hyperinflammatory reaction to something. We don't know what it is yet. No one knows yet exactly, but it's strongly associated with COVID-19 because the normal cases of the other two aren't showing any signs that are connected to it. So this seems to be something slightly separate. It might just be an immune system response to the thing that's novel. Takeaway, and my guess, this is where I ramble on for a few minutes, maybe. I'm suspicious that this would be a reaction to a digestive tract infection of COVID-19 rather than doing anything to your lungs. All of the other diseases I looked up that are genetically related to or strongly related to COVID-19 show an oddball component of it transferring into a person's digestive system instead of getting into the upper respiratory system, not ever getting into the lungs, getting into the digestive system. And like in bats, it can be carried in the gut and the fecal material. And then and this is very important, it can stay active in that material. And then, this is very important, obviously in bats that would actually help spread the damn thing, so maybe it would cause it to be more likely to happen, which is kind of sad, because that may mean that may be the way it is actually transferring in every other way, which means you'd have to literally not have any bats outside in the sky being able to relieve themselves while they're flying. But anyway, if this is getting into the gut instead of attacking the lungs, you would think that this would be a less damaging thing and would cause an immune system response that would strengthen your immune system. And that would be true. You could technically drink or swallow a capsule with COVID-19 in it and have it not get in your lungs and get your immune system to respond. That may end up being a method for doing it, even if it's dead COVID-19 that's been blasted with x-rays or something. But if a person has this strong of a reaction and doesn't get sick, shows no sign of it, this may be an example of gastrointestinal COVID-19 infection. And if it is, that means that potentially that one other way we could have a vaccine may be abnormally dangerous. Other viruses similar to coronavirus, this particular coronavirus, similar to it, if it gets into the digestive system, which is rare, but it does happen, instead of spreading the way we think of, it ends up causing a lot of the same responses, but not normally possible damage to the heart or causing a person to go into such a strong shock reaction that they die. My guess is this entered the digestive system instead of the lungs or through the nose, and the person's body is reacting to it violently in a very small number of cases. A lot of the asymptomatic cases may be hand-to-mouth transfer, our version of hoof-to-mouth. Thanks for watching. Have a good day. Good luck with that. And I hope I'm completely wrong about everything here, and I'm sure somebody will tell me happily that I'm wrong, and they'll post it down in the description tomorrow. Bye.